Hi, everybody, we'll call the meeting to order. It's about 5:32. And ask Karen if she would do the land acknowledgement today.
Sure, thank you.
Thank you.
As chiefs to the Tlingit, Haida, and Chibcha people, we respectfully acknowledge them as the original inhabitants of Southeast Alaska. Bartlett Regional Hospital is located on the homelands of the Occoquan. We are grateful to provide services in your ancestral homeland and to be a part of this community.
Thank you, Karen. Anita, will you do roll call?
Insone. Max Mertz,
Excellent.
Dr. Raster. Lisa Peterson. I'm here. Al Geiger,
Present on the online.
Dr. Jones,
Present online.
Kelly Deering. Here. Deb Johnston. Here. Denise Solomon Gross.
Here.
We also have Dr. Muller and friends.
Thank you, Anita. Any agenda changes anybody would like to know? Yeah, you want to make an approval?
I move to approve the agenda as presented. Second.
Thank you. No objections, the agenda is approved. Is anybody from the public that'd like to speak today? Not seeing anybody from the public in the room. I don't see anybody online that's from the public. Right to the consent agenda. Yeah, or make a motion.
I move that we approve the consent agenda as presented. Second.
Any objections? Seeing no objections, the consent agenda is approved. And we'll go right on to old business with Kim.
Thank you, Mr. Chair. Can you hear me okay?
Yeah, thank you, Kim.
Okay, thanks. I think you called on me to do the hospital update. So we have 0 COVID patients in-house and no employees out with COVID. Our patient days for February for CCU was 79, Med-Surg was 435, OB was 53, nursery 33, mental health unit at 293. They currently have a census of 8 and they're reviewing packets. ED saw 844 patients last month. Rainforest Recovery has 14. Crisis had 23 patient days, which equals into about 21 encounters. I will let Kim Stout give you the census for Wildflower Court, Home Care and Hospice. We currently have 4 subacute rehab patients waiting for placement. 1 is not medically ready. 1's resistant to going to SAR. We have 3 waiting for assisted living. 2 beds are ready. One patient is not ready to go quite yet, and we have 2 waiting for long-term care. And I'm happy to answer any questions.
Any questions for Kim? Great, great. Kim, Scott, you want to give your salary?
I can do it now.
That's good, guys.
Wildflower Court has 46. We have 2 admissions. Hospice has 9 active patients on service, and Home Health has 24.
Thank you. Anybody have any questions for Kim? No? So thank you, Kims.
New business, so we're going to,
My report is relatively short. We have formed the search committee. There are a total of 7 of us, with Chad providing administrative supports. The committee consists of myself, Shelley, and this deputy chair, Maria Yucatan, Nick Rosenfeld, Bob Urata, Robert Barr, and who am I missing? I got Maria.
Yes.
Yeah.
Oh, yeah.
That's twice I've done that. We're going to get started next week. We haven't scheduled a time. We're trying to balance everyone's availability, but hopefully middle of next week, we'll have our first our inaugural meeting in which we Chad's providing us some information with regard to draft timeline, a proposed posting, which will include some recommended criteria and a high level position description, as well as some thoughts on how we want to move forward with what the candidate experience looks like once we get down to those final candidates. So that's where we're at this point. We're shooting for. I said my goal was to have a candidate selected by September 1st. Knowing that things happen, ideally, at the latest, we'd like to have someone on by the end of October so that they can have the opportunity to spend a month or two with Ian in the transition, and they'll be ready to go by January 1st.
Thank you, Deb. Does anybody have any questions? Rest.
I recognize all the names except Chad.
Oh, our human resource.
Thank you.
I'm so glad that you said that.
Any other questions? Thank you, Deb. And yeah,
Thank you, Mr. President. So I have an action item on the agenda today regarding the COVID vaccine. The issue that I'm asking you to take on is we had a COVID-19 mandate that was adopted by the board in August of 2021. And the action item I was asking you to take on is to rescind this board mandate. And as you can read the action items here, I just had a quick statement that I just wanted to read to you since it did not get into the board packet. This is a quick statement. This is from Charlie Griffin and Chris Sperry. So Charlie is our infection preventionist and Chris Sperry, our director of pharmacy, will support retiring the requirements set by the board in January 2021 regarding all BRH employees to be vaccinated with the primary series 2 doses mRNA or adenoviral vector vaccine to prevent COVID-19. This action to require the initial vaccination was extremely important and saved lives and prevented serious disease in Juneau and within Bartlett Hospital. We are grateful for the support of action when it was needed. Now we are in a much different place than we were in the winter of 2020-21. 96% of our employees have had the primary series and we maintain an up-to-date vaccination rate for our COVID than the national rate. This adherence to staying up to date also prevents serious illness, hospitalization, and unnecessary sick leave and time away from work. We request that the board rescind the 2021 COVID-19 vaccination mandate. This will help avoid confusion for COVID vaccination to be in line with the current CDC recommendations, which is to receive 1 or more doses of the current formulation COVID vaccine. It is the BRH policy that any recommended vaccine to communicable disease be offered by BRH Employee Health, tracked by Employee Health, and if a declination is requested that the employee sign a declination form and wear a droplet mask continuously at work. And Charlie and Chris who provided this have their information. If you have any questions, and I can provide anything else in support of this motion.
I move that we approve Move the Board of Directors of Bartlett Regional Hospital rescind the 2021 COVID-19 employee vaccination mandate.
All right.
3 seconds.
Excellent, thank you. My computer just died, so I can't see it. Any discussion on this? Anybody have any questions? Great, okay, seeing no objections, no discussion, that motion's passed. And the chair is this year.
No. So,
And since we're going with that, Dr. Malter.
Thanks, Mr. President.
Dr.
The medical staff met and it was business as usual. There are some, there's a credentialing report and the minutes later in the packet. Otherwise, business as usual. Questions? Yeah, finishes that report.
Sure, are there any questions for Dr. Walker? Seeing no other questions, we're gonna move on to the committee meeting minutes. I am going to present the finance committee on behalf of Max Mertz. For the most part, the minutes accurately reflect the activity within the committee. We've had several action items that I'm not ready to do. All of them? Anyway, we had several action items, all of which were taken care of either at the March 8th meeting or in our consent agenda. So that was a fair section of the finance committee. Joe, if there's anything I'm missing, we already approved the budget to be presented to the Assembly Finance Committee on the 6th. I'll entertain any questions if you have any.
So no questions concerning the information that's in the finance packet. Joe's here to answer any questions too as well. Thank you, Madam President. We're gonna move right to Dr. Jones with the board quality minutes and talk about the board quality minutes.
I think the minutes accurately reflect our meeting. I don't believe we have any action items. Do we?
No.
Okay. So that's all I have to say.
Excellent. Thank you, Dr. Jones, and I agree with him. I was at that meeting, so I think the minutes do totally accurately reflect what's happening in the meeting and it continue moving forward. Questions about quality? Thank you very much. And then we're going to go right to you, Lisa.
Thank you. We held a governance meeting last Thursday, 7:30 in the morning, and I believe the minutes also reflect what happened in that meeting. It was a short meeting, but we got quite a bit done. There are 2 action items that came out of that meeting and then one thing to report. The first was the board education gap assessment results. And if Gail would be willing to address that, that would be wonderful. We did a lot of really good work on this.
Thank you, Lisa, to the chair. So this was tasked in the November governance meeting to look at doing a knowledge assessment for the board. And this information will be used for moving forward for planning the board information and the retreats for this year. And the
knowledge assessment really shows a good, robust knowledge in our board members. We have a solid board that has a well-rounded knowledge, which is what you would expect to have a hospital board. But it does show that we have a couple of areas that we want to focus on that the board identified around financial reports, financial knowledge. So those are the areas that we're probably going to schedule some education first. Liability, conduct, those are some areas that you ask for more education on the front end. And you also identified some good areas for what you find is most important. The other interesting part of the assessment was how you wanted to receive your education. So most of the board members rated that you wanted to be front-loaded with education independently. So that is what Lisa and the governance team is going to be looking for, is looking for self-paced information that we can provide to board members first, and then being able to coming in and providing it as a group. So we'll be developing a education plan for the year for the board, and being also to provide committee-based training for individual committees, depending on what committees the board members are on this year.
Yeah, anybody have any questions for me? Okay.
Well, I'm gonna do it one at a time. So the first one is back in, I don't remember what month it was, we were asked by the board of directors, a group, to draft a code of ethics and conduct. And so we looked at the current bylaws and the board policy manual, and we determined that there was a need to do this. And so we conducted some research, and we developed the code of conduct and the ethics that is presented in the packet. I hope everybody had a chance to review it. It is about 2 pages long, and I'd like to open it up for discussion before we move forward on the action item concerning it.
Okay, so I was not at the governance meeting, apologize. But I want to know, this was made a motion in the governance committee and moved through and stuff like that. Okay, so we do have a motion on the floor right now. So now's the time to have some discussion on that. So does anybody have any questions or anything about the motion that is in the packet that's already gone through committee work?
Through the chair, I would just like to say I appreciate the work that was done on this, and I believe it is a concise document that states what we should be doing as board members.
Thank you. I totally agree with you. Thank you. That Lisa, do you have any
Comments at all?
No. All right. So with seeing no objections, the code of conduct is passed. Next.
All right, so then the next action item was we were also asked to develop fiduciary standards for the board, because the current bylaws and the board policy talks about fiduciary responsibility, but doesn't actually define it or discuss any standards behind what that means. And so we did create the fiduciary responsibility. We did highlight the primary duties, including duty of care, loyalty, obedience, confidentiality, prudence, and the duty to disclose. And the really good part about that is this is also included in the board assessment. So it just naturally flows to something that we need to do every year. We need to assess people's knowledge about that, but we also need to have a policy in place so that we have standards, so we all know what we're working towards. And so we defined a breach of fiduciary duty as well as assessing the board understanding of it. And then a short paragraph about conflict of interest, because there's not a whole lot in that for people to look at. And so I'd like to open that up for discussion in this item too. And we did vote to the motion to accept this during committee.
Okay, so we do have a motion on the floor, and now's the time for discussion. Anybody have any questions or comments on it? So I just have one here. So this is something that's new, that's not really in anywhere. So this is just kind of new work that bringing there. So again, to Sally, I want to thank you very much for all the hard work you've done. And also note that something like this that just comes brand new to the board that you guys took on, and with whoever your staff person was really good, and it'll be looked at again, I'm sure, next year and years to come, to see if we can update it, change it, make it better. So this is great. This actually came out of a lot of our board meetings and other ones of our meetings. So I personally think this is a really good start. And I know you guys had some help with wordsmithing, so it's really good. And everybody that worked on that, thank you very much.
And I want to thank Hal for that, because he fixed some of our little issues.
Anybody else have any comments, questions? All right, seeing no objections, that motion is passed.
Thank you. And then, let's see if there's anything else. Nope, we adjourned. We did leave. We did not schedule another meeting just because we're waiting for the legal counsel and the board retreat. Then it is our intention to review the bylaws after that.
And so you guys did talk a little bit about the possibility of a board retreat, or I know that we want to do this. Did you guys have a conversation on that?
We just talked about that it's pending. We did, but we didn't plan anything.
Okay.
So no, there's nothing, there's no calendar. I'm looking for you to go to Hawaii or something.
That's good. All right. Thank you very much.
You're welcome.
Appreciate you there. With that, we're gonna turn this over to you.
Thank you, Mr. President. As you will recall, last month, theme of my letter was, what is reasonable to expect a hospital to generate so that it can be self-sustaining into the future? And this month, the theme really is, how do you start getting there? Okay. So one of the quotes I had from the Dalai Lama is about discipline. One of the things that a hospital has to do is be very disciplined about how it approaches certain things. I know the medical staff has a very disciplined approach at how it brings on and credentials physicians. We also have to be very good about that. So I went through kind of some of the disciplines that we were implementing. And the first one that you've heard about is our A3 development. That's where we've asked every call center to go through a specific process and develop a sheet that basically describes what they're going to do and how they're going to do it in terms of improving it with goals related to growth, related to improvement of process or quality, and also ultimately the employee engagement. Those were presented to all of management, and we gave them a quarter to start working on those, and we had a meeting with them in terms of how well they've achieved their goals in the third week of April. And that's a discipline of how you go about looking at each one of your areas. There was very good work. I was very impressed with the individuals that are doing this. They do some excellent work. And it gave me, as a new administrator, an opportunity really to understand the organization a lot better. There was more than just one reason to do that. There's also trying to embed a process of how we improve on a constant basis. And I think I had mentioned that process to you. It's one of the commitments, I think. That's one. Another one that is extremely important is how you manage your labor and workforce. And so most places have a process that's considered a best practice where you have a hospital-wide process for looking at FTEs. Okay. And the people on this committee, it's not me, it's Joe, it's Kim, and it's Chad. CFO, COO, and then also Director of HR. So that we can look at how many FTEs we have, how many do we need, where do we need them, right? It's more important to make sure that it's very hard to get in because it's very difficult because of different types of policies to remove people from their positions. And so I gave them 3 tasks. The first task is let's review every single FTE that comes in here and make sure that we actually need them and that there's not ways to substitute for that or move a person around that might need a position. Number 2, let's work on reducing the amount of travelers. Travelers is very important to have, especially when you have a high season. But travelers do not know your system. They don't know your people. They don't necessarily know you as well. So it's not as good a healthcare. And of course, they're not spending their money in the community and part of it. So it's really important that we do that. The third was look at productivity. We know how many patients come in. We'll have to be able to establish productivity measures for each one of our areas. So again, that's looking at the whole. And it's a very important discipline to have. And hopefully, as a new CEO is chosen, they basically maintain some of these practices. That's what I'm hoping for. Another one is contract review. We're looking at every single contract and putting it into 2 categories. Is it necessary or is it nice to have? And if it's nice to have, then we put it into 2 other buckets. Is it local or is it national? If it's nice to have and national, then I don't see any reason why we should keep those contracts. And we're already identified a couple $100,000 of contracts that we can actually do. The other reason you want to do this is there's duplication of contracts. That's especially the case in areas where you have different applications. And so, for example, we pay for Zoom, but we also have Microsoft Teams. Do we need both, right? And so as part of the other discipline, Chris is establishing a governance committee for over IT. We've asked the medical staff to provide somebody for us that you can get the peer view of our systems. And we will then meet, I think our first meeting is next week. We will then go through every single application that's up for consideration and say yes or no. Why this might be a good or not a good reason to do that. That way, you have to coordinate your systems, not only across, so for example, how you do Meditech has to also coordinate all across all your hospitals or hospital, as well as all of the subsystems within. So there's a lot of work that Chris is working on, and that's a really good movement forward. So those are some disciplines. I failed to mention Gail. She already had the A3s here. All I did was link on that process and get it embedded in the organization. I've been a big fan and used A3s for a long time. It's probably a new document. So 3 disciplines, there's more yet to come, but those are the first 3 I want embedded. The second is, how do we do program review? What I wanted to make sure is people understood, when you start looking at various different programs, there's a method that we go through. And, there's a number of different questions we have. What programs would you typically find in a small hospital? What programs are self-sustaining or losing money? So you understand it. Can you improve the program in a reasonable amount of time? I don't know. Sometimes a program means a change in practice of medicine. It may be there in other communities, but if it's not here, that's a big order to change the practice of medicine. And what is added to us over the last couple of years, and how do we approach those? And then I finally add into, okay, let's put them in a quadrant. Is it strategic in making money? Is it strategic not making money? Is it not strategic making money and not strategic not making money? Each of those has a different way that you want to approach it. And when you go through that exercise, it becomes clear what you might have to do. And you can do it at any level. You can do it all for Bartlett Regional Hospital, or you can do it just within the hospital component. You can do it with various different programs. And then we have to go through, you know, is there a addressable market? How big is the market that we can address? Is it too small to survive, or is it a really growing market that we need? What's the reimbursement available for it? Is there any subsidization available to us? Can it grow? What's the level of productivity and staffing that we need? I gotta put my glasses on, sorry. Time frame to improve and the level of effort to fix. Some things are really difficult to fix. The question is, do you want to focus management time on fixing something that's a relatively minor program? Or do you want to focus on something that's really key? I do think there's growth in this community, but it has to be growth around oncology services, the first stand of oncology, probably orthopedics. Cardiovascular is difficult, but our new machines and diagnostic imaging, we do more diagnostic imaging and diagnostics of cardiovascular disease, which then we have to go to some other hospital to be able to fix. Those are areas that we can really improve. And so this letter is a link to the prior letter. This is what we need to be able to be healthy. This is a process of which we're going to go through. And as we go down, we'll be making more and more recommendations to the board and to the city. And I have to bring the information to the medical staff here next week. So this is all leading up to kind of the process that we're going to go through in terms of the city budget review, which is a week from this Saturday. I'm meeting with, I think I've met with all the board members except with Hal and Dr. Jones. I'm meeting with the city assembly members. I've met with a number of them. And I have yet to set up some time to meet with the staff so they understand the issues. But again, if you're reading my memos, you start getting the sense of how we're approaching it. We're very careful, we're very deliberate. We want to make sure that we don't disrupt what I would consider a very good medical community. You don't want to do that, but you do have to nip and tuck and do some changes here to be able to be sustained. So again, the next theme will probably be more specific of what I'm going to do. But I'm not going to do it without the advice and counsel of the city, of the board members, and the medical staff. I'll stop here and see if there's any questions.
Thank you, Ian. Anybody have any questions for Ian? Anybody online, Hal?
Yeah, yes. Can you hear me?
Yes.
Okay, because I'm plugged in. I'm using my earphones. I can't tell if that worked. Okay, I just wanted to be sure that I understand part of what the product that's coming out of this. One of the things that I've wanted for a long time is a clear idea of what each of these programs cost and what the revenue is. Because I just don't see how at a board level we can do a program review any other way.
Yeah.
So I'm hoping that we're not just going to have things in this matrix of strategic but not profitable and so forth. But I'm hoping we'll go through and be able to find obstetrics, diagnostic imaging, rainforest recovery, and at the end of this, a board member will be able to see what each of these programs cost and what each of these brings in. Is that going to be part of this review?
That level of detail is there, yes. So it'll be part of our discussion with you, Hal, when we meet with you next week. When is that? Do you know?
I'm in Hood River, Oregon now, so I can't meet until next week.
Yeah, I know. I think it's next week, like Monday.
Monday, I think it's Monday.
So Joe's going to be meeting with you and briefing you on all the various breakouts that we have, and then I'll be meeting with the medical staff leadership.
I don't think I have that on my calendar. This worries me a little bit. Maybe I'm not looking in the right place.
Monday at 1:30.
Just Hal.
Monday, 1:30. No, it's Deb is there too.
Hal, Deb.
Joe and
Joe.
Oh, yes. Okay. It's on my Barton calendar. Okay. Thank you.
Yeah, I think you can have a lot of your questions will be answered. And then it also have more questions too, I'm sure.
Okay, thank you very much.
Thank you, Hal. Anybody else have any questions or comments for Ian? You want to continue?
No, I'm done, with the exception of, I think it's really important for us to go through this process. And the reason that is that this is a community-wide asset that we need the wisdom of the assembly, the board members, medical staff to help us make the right choices. So I see that as a really important step for me to engage in, because I need that feedback of what makes sense and what we're able to do, not do. And once we get a consensus about something, we'll start moving forward pretty quickly. As part of that process, I've asked the staff to start putting together what I call a decision point document. That's a document for each one of the columns that you'll see that gives you basic facts. This is when it started. This is, why pro forma might be off. This is, how many patients we have in there. This is how many of those patients come from City and Borough of Juneau. This is how many come out. Basic facts, and then our assessment and analysis of what we can do or not do.
Thank you, Ian. Anybody have any questions? All right. Well, thank you. Yeah.
Thank you. I'll speak to home health first. Since the last board meeting, we did have our state, federal, and our emergency preparedness survey. We have received our report back and we submitted corrective action plan today. We had 0 findings on our emergency management planning survey. We had 2 on our state survey and we had 3 on our federal, and they were duplicates. So really 3. And so it was a really overall a very good survey. So we should be hearing back hopefully within the next couple of weeks if they're going to do a desk audit or come back and look at us to see if we truly corrected our findings. Hospice services, the good news is, and I let the senior leadership team know this morning that we have received our provider number today. This morning, I can have that even this morning. Yes, this morning. And so we're gearing up to start getting those bills out the door as soon as possible. Hospice services, Dr. Peterson and Heather are out trying to go to community functions to educate the public more on who meets criteria for hospice, why would you want a hospice, answer all the questions that the community may have. And then to Wildflower Court, on another positive note, Wildflower Court has also received notice today that we not only have our Medicaid provider number, our Medicare, we received our Medicaid numbers today as well. So that's all good news as it relates to Wildflower Court. Other than that, I think I spoke to our survey the last time we were here. They accepted our corrective action plan on all of the items that we submitted. So I will anticipate probably a revisit. Everything has to be in place on the health survey by April 1st, and on the emergency preparedness, we had a couple of findings and it has to be implemented and in place by April 8th. So I expect to see them back probably sometime around the end of April.
Thank you, Kim. Anybody have any questions for Kim?
Great news.
Hal.
Oh, I don't want to go on and on, but I am so pleased with this, and I really want to thank Kim after all the many times I've pestered her at so many different meetings over such a long period of time. I just want to say thanks so much for all your work on this.
Thank you. You're welcome.
Thank you, Kim. Do you have anything, Lisa?
No, I just think it's wonderful. Start going.
You must be happy over there. Great. All right. We will move on. Mr. Palmer's online. You want to pop on here? I know he doesn't have much today.
I sure could. It's good to see you all. Thank you, Mr. President.
Good to see you, Mr. Palmer.
Yeah, I do not have a report other than one small item to note. Big compliments to Ian and the staff, but we were able to finalize the contract with our outside attorney group. So it'd be Hall Vendor last week, and we have an initial meeting set up tomorrow, and then we'll get them lined out and you'll see them on board meetings and interacting with staff and the board.
Great. Anybody have any questions for Mr. Palmer? We know you've been busy, so it's good to see you. Thank you. All right. You want to go on? Go to Maria.
Thank you, Mr. President. Really good news. Edelman scholarship materials have been out and distributed throughout Southeast Alaska. I'm probably working with Aaron and have a press release out to the community later this week. And closing date for applications is May 24th. We have in the budget about $30,000 to award in scholarships, and I say about because depending on the number of applications and the quality of the applicant students, sometimes we go higher, sometimes lower. But that's the starting point to do that, and we're very excited about that. The Give from the Heart payroll contribution campaign, it continues open, and the levels have the same as they've been in the past. The foundation is on a calendar year, so we're closing out our first quarter in a couple of days. And as an incentive, I'm thanking all those participating, we're going to provide like a $5 coupon to Hotshot, to the people contributing from the foundation to the employee. And we are also going to have an incentive for anyone who signs up in the month of April, something. And Mr. Bryson is going to help out with some of that, and indicated, and some of the Hotshot coffee cards. So hopefully that is some incentive for individuals to enroll in the contribution. We're looking forward to that. Happy to report that the very popular Kid Art Gallery show is coming back. We're working with the schools. We have about 40 pieces, might have some more depending if we can get some better quality frames donated, and then work with the students. We'll finalize that this week, hopefully by Friday, when they're gonna come in, swap out the work, and then make arrangements to have the show in the gallery as we used to do pre-COVID. And that's where the departments will come in and they will select kid art for their areas. And it's very popular, hoping to have the kids come this time, and they have cookies, refreshments, and they just love, certificates for the kids. They just love seeing their art being selected and placed in the hallway. So that's a great program. Like I said, we're closing out the quarters and the numbers look really good. I'm always afraid of looking at Q1 numbers for contributions because they're kind of soft, but this quarter has been really good, and I'm happy about that. And the gift shop have been doing very well as well. The gift shop is one of those things that if we don't lose money, we're happy. So we're meeting budget and just slightly above that. So those are really good news. There's a chart in there that you could see about the donations this quarter. And one thing that is not on the report that we've been working on this week is the wildlife cruise is coming back, and we selected June 15th, the Saturday before Father's Day, to have the cruise. And we're working on a pricing scheme. The cruise actually doubled in price from what we paid last year. So it's another one of those things. It's a morale perk for Bartlett. We don't charge a lot, but if we don't have to make money, we just can't lose money. So we're kind of working with these numbers right now to have the pricing set, and communication will come out to the hospital staff. Hopefully in a couple weeks. That is what I have. Thank you.
Thank you, Maria. Thank you for all you do at the foundation. You can just see the numbers in her report, how much money the foundation gives, or make sure that we're able to help fund ED projects and whatever with all your work, and the way that the employees actually get back to making sure that the foundation helps support Bartlett too. Anybody have any questions or comments for Maria? Thank you again. Thank you for. And Mr. Bryson, our CBJ liaison.
Thank you, Mr. Chairman Gross. So the assembly has been on a little spring break. We had a couple of weeks of no meetings. Next week, we have a regular assembly meeting, but then on April 6th, we kick off the assembly budget set season. We have a whole Saturday, 8 hours, so we get to discuss CBJ budget. And ideally, that's going to eliminate 3 of the nighttime meetings that we had, because we meet every Wednesday for 2 months. I did get to meet with both President Solomon Gross and Mr. Warden, and I was very pleased with the presentation. If that's the information that he has given to all of the assembly, I think this assembly is going to have a really clear picture. Like I fully understood where the hospital was at after talking with John, so I greatly appreciate that. And I want to thank Nate for helping me complete my tour of the hospital. Wildflower Court is gorgeous. I had no idea that it was that nice inside. I got to take the little secret tunnel over there. I was very happy. And Nate and I just have to go see the morgue, and my tour of the hospital will be complete. And that's all I have for you today, Mr. President.
Thank you, Mr. Bryson. Thank you for taking time out to kind of meet with Danny and myself. Unfortunately, I'm not going to be there for the April 6th meeting. You guys are really in good hands with our finance team and Deb helping us too. So thank you very much. That goes right to my president's report. So I have some exciting things to talk about that I'm going to actually let Ramsey talk about. Maybe you can come up over here and sit over here. So
Sure thing.
oh,
Thank you, Mr. President. I just wanted to announce for members of the board and the administration some good news that we received $4 million in congressional directed spending through the FY24 federal budget process. And especially because we have some new board members here as well, I thought it would be nice to take a little bit of time to just remind the group of where we are within that process. If that work for you, Mr. President?
yes, please, Nate, go ahead.
Thank you. So Bartlett had prioritized a project to expand and renovate the emergency department in the 2021 facility master plan, and has received approval from the board of directors to develop the initial design documents for that project. The primary objectives of the project are to improve patient access, to improve patient and staff safety and security, to create more efficient and flexible space for ED operations, and to address emergency medicine best practices in response to the COVID-19 pandemic, specifically regarding airborne infection, isolation, and negative pressure exam and specialty care. We've also identified several opportunities to work with federal, state, municipal, and grant funding entities to provide financial support for this important project. And I just wanted to make specific note of this. We're sincerely appreciative of Senator Murkowski's support and advocacy for that $4 million. Working with CBJ engineering project managers and the Architects of Alaska, we anticipate completing the 35% design phase documents within the next month or so. And then just for visibility, additional high-level project updates will continue through the planning committee as we move forward. That's what I had for that update, Mr. President, and I'd be happy to answer any questions.
Anybody have any questions for me? I kind of do. How will this money come to us? Will it come quickly or how does it?
Through the president, we'll continue to interact with Senator Murkowski's staffers to reconcile that. It is FY24 funding. It's my understanding that there's not a specific expiration date that is assigned with that right now, but those are details that we're going to have to work out, specifically with Senator Murkowski's office. And I'd be happy to provide more information to the group once we have those.
Yeah.
I have a quick question, maybe you may not know the answer to this. My experience with directed funding is that it ends up in a specific department within the government. Do we know that yet? Or how that's gonna, will it end up with, it won't be in transportation for sure, but will it end up in?
Through the president, it was identified as a reference document associated with the appropriation for the Department of Health and Human Services.
Yes, go ahead.
If you could remind me, what did we ask for? Did we ask for 4 million or did we ask for more?
We did not, through the chair, we asked for $15 million originally, but that was also prior to us making some changes with the scope of work that we were anticipating covering. Since that time, we've had several conversations with Senator Murkowski's staff. This is what they were willing and able to advocate for us, along with all the other programs that they're looking to support in the state of Alaska. But $4 million is a significant portion of what we anticipate that project costs to be.
I don't see any questions. This is just great news. Thank you very much for giving that to us. It's hot off the press in Chester, is there? It's great. Yeah, I'm sorry, Mr.
You didn't, I went to the party. And we're still working on the, oh, you know who I'm talking about. No, not Rasmussen Foundation,
The Denali Commission. Through the chair, yeah, we have finalized the narrative portion of that grant application. We're going out and getting some additional letters of support and anticipate being able to submit that request by the end of next week. That's a $2 million request. That's the maximum amount of funding that we can request under that grant opportunity.
Thanks.
And this is the grant that we didn't turn down last year, but we're more ready for it. They actually encouraged us to come back this year, so this is really nice to complete that project. Great, thank you, Nate, very much. So just kind of continuing my report. We have some good news, you know, as far as I know Mr. Palmer talked about it, but we actually are now have a signed contract with our new legal firm, Hellrender, and I think Ian and Mr. Palmer are going to be having an initial meeting tomorrow with them, which is great news for us too, and we're hoping to get some priorities together with Ian next week and start moving forward with our new legal counsel. Again, too, out of the governance committee, last time we talked about setting up the board retreat. So again, I missed that meeting. Sorry about that. So hopefully we'll have some more answers for the next May board meeting on where we're at with the retreat. I was able to attend, I think, all of the meetings so far with the board members and the assembly members. I am leaving for work tomorrow morning on the dark 30 flight. So Deb, who has awesome grasp of this, will be there with the rest of the assembly meetings and the rest of the board meetings. So thank you very much, Deb, for doing that. With that, I'm open to questions from anybody. Walter, saw you had your hand up. All right. Well, then we'll move on to the board calendar. So, and on Tuesday, the 2nd, Deb is agreed to go to that meeting. And we're planning. Yeah.
Planning is fine. All the planning committee members have agreed that this is the appropriate date.
And it's a good information for them probably moving forward.
We will, Nate and I are gonna meet.
Perfect.
And go through create an agenda.
So Max isn't here. Has he talked with you, Joe, about the finance meeting being on the 12th? Is that a good date?
Yeah.
It's good. Yeah. And we don't have really any other committee meetings scheduled for the month of April. I guess we're gonna wait.
I was gonna wait on governance until talk to the lawyers, then I'll schedule it after that.
Sounds great.
I won't forget.
Okay. Great, well, I think that calendar, so motion to approve the calendar.
I move we approve the calendar as presented.
I second it.
All right, thank you very much. So now is the time for board comments and questions. And I'll open it up to the board. Dr. Hester.
I just have a comment. I think this, I see Debbie Kesselring is on, and I think that this might be her last meeting because she's moving on, and it just, you know, she doesn't do as much for the board perhaps, but she's been invaluable to the medical staff in the almost 30 years I've been here, and so it cannot be overstated how important, how much important she's been, how important she's been in terms of our bylaws and just the historical sort of perspective and helping the physicians in this community. So it is with great sadness that I think this might be Debbie's last board meeting.
Thank you, Dr. Astor, and thank you, Debbie, for all you do. And I did get a chance to talk to her, so she's kind of excited about her new challenges that's coming up, and she's worked really hard to do that. So we all wish her well. I don't know if anybody else wants to say anything.
You know, I think that last date is the 26th. For some reason, I thought the board meeting was the 4th Tuesday. So I was anticipating saying something in April.
It is the 4th Tuesday, that's my mistake.
Okay, so it is the 23rd.
It is.
So we get one more meeting with Deb, and Deb, you gotta come because we want to say something for you then.
So the board of directors meeting on the calendar is actually the 23rd, not the 30th, correct? So
Correct.
we will make an amendment to our last motion.
But since John brought it up, of course, the entire medical staff will be so discouraged to be losing Deb. You know, the medical staff here does a lot of work kind of behind the scenes operationally. Administration helps, but for better or for worse, Deb really keeps us organized. And when I have my med staff meetings, I really look to Deb, I think the same way that the board looks to Mr. Warden, for example. And Deb keeps us on track and explains why things are the way they are, and it'll be a big loss for the medical staff.
Thank you, Dr. Malter. We'll hear more, I guess, at our next board meeting too from. Any more comments, questions from the board? Right, so it is 6:30 right now, and when we come back, we will go to the executive section. So right now, we'll take a 10-minute break and back at about 6:40.
One down there, do you want me to come back and find you over there?
I'm gonna stay, but we'll go to the executive session, and Jim, will you take us in there?
I move the board of directors of Bartlett Regional Hospital recess into executive session to discuss several matters. Those which by law, municipal charter, or ordinance are required to be confidential or involve consideration of records that are not subject to public disclosure. Specifically, the credentialing report, medical staff meeting minutes, patient safety dashboard, and union negotiation. And to discuss possible BRH litigation, specifically a candid discussion of facts and litigation strategy with the DHS and city attorney.
Thank you. A second. So we are officially in executive session, so we'll move anybody that needs to be in here. Make a motion about the credentialing.
I make a motion that we accept the credentialing report. Except the credentialing report as presented.
Second. Dr. Esther seconds that. All right, with that, I don't think we have any more, so we are officially adjourned. Thank you, everybody.
I want to say it was.
Yeah, I'll just, cash flow. 2 months, I want 2 months.